So we've done about 12 of these so far. So I've interviewed Alex and Steve and then Neve and people in South Africa and Brazil and Mexico and Australia. And there's a whole series of these things coming up. And yeah, they'll touch on lots of different topics, some very clinical, some policy, but it's just giving people that voice and platform.
Let the media hype this. You know who we got here?
Hello, Magdalena. Thank you so much for joining me for a Corona conversation. For people who don't know you, can you tell us a little bit about what you do, where you work, and where you are today?
Sure. Thanks, Adam. So I work as I'm an Associate Professor at the London School of Hygiene and Tropical Medicine, and I've been working around issues to do with people who inject drugs, reducing harms related to drug policies, related to injecting health harms, things like that for about the last 15 years. And at the moment, I'm at home in London because of the coronavirus.
Accent is not a London virus, because you is a Kiwi.
Yes, I'm a New Zealander.
Is that right?
Yeah.
So we're going to talk to Ross Bell about what's going on in New Zealand later on in this week. But anyway, our first New Zealander. Good. So, as a specialist in harm reduction when it comes to injecting drug use, the first thing I want to ask you is for people who are currently injecting drugs in those environments where NSP exists, where there are resources. What do they need to know about Corona to keep themselves and those they spend time with safe?
Okay, well, I guess it's the usual harm reduction advice, but added in the social distancing measures, which is going to create a whole lot of additional issues, especially for people who use together. So using can be quite a social activity for a lot of people, and a lot of people out of necessity are pooling money, are pooling drugs, are cooking up in the same spoon. And you know, it's difficult to know how motivated people are going to want to be to social distance, because sociality plays such an important part in the whole drug using and is indeed a necessity. So, so there's a big issue there. I mean, you know, otherwise it's exactly the same thing. Try and use your own kit, try and keep everything clean, but with the added addition of, you know, cook up and inject 2 meters away from your using buddy. And none of this is necessarily possible, especially if you're using on the street, especially if you have limited resources. And I think what is most important in relation to coronavirus are going to be the pressures placed on pharmacies and on drug treatment services, so that people may not be able to access the injecting equipment they need as easily. And they may also have problems with getting their opiate substitution therapy. And probably most importantly, there are likely to be disruptions to the drug supply, which is going to impact upon the amount of drugs people can get, the quality, and crucially, their money, their ability to get money to generate, to buy the drugs, because, you know, the majority of people that I'm working with and I speak to, a lot of their money is around, generated through begging and through other activities such as sex work, which have all been absolutely decimated by the coronavirus. So there are huge issues there.
So I want to go back to the first bit about the socialized nature of drug use and how difficult it might be to put social distance in a community where people are using drugs together. But I want to know, are there practical tips? So I understand people pool their money to be able to purchase their drugs. Is it worth saying to people, at the point of purchase, you split your drugs, you each walk away with your own drugs, you then make sure you've got your own spoon, your own tourniquet, you know, your own clean surface. And, you know, if you're in a bed sit or if you're in a shared space, you know, you can be at the other side of a room, you know.
Yeah, absolutely. Absolutely. I mean, if you've got, you know, hand wipes, or even put a bit of hand gel on a bit of tissue to wipe the pack that you're getting from your dealer or whatever. And then if you can split it and put it into, two little, bits of tissue or something and take off and prepare your own drug separately, then absolutely. But still, one person could do it in a spoon and draw up into 2 clean syringes and throw the other syringe across the room at the person. There's actually, you can still do this. It is possible. I think something I'm actually more worried about in relation to transmission and in relation to vulnerability around coronavirus and people who use is crack use. So in my recent study, we interviewed 455 people who inject drugs in London, and the majority of them still smoke. They smoked crack as well. And I think there's a lot of emphasis, particularly around injecting, on the act of injecting. And often people don't get asked about what drugs they're actually smoking as well. So a lot of people in London and probably throughout the UK may be injecting heroin or injecting heroin and crack together, but also quite often smoking crack or alternating smoking heroin as well. And there's a huge issues for respiratory problems. So there was a big study in Liverpool not long ago where they tested 800 people who smoked heroin for COPD, and 50% of them had symptoms of COPD. So you've got a really, really vulnerable population, vulnerable to health harms and vulnerable to the impacts of coronavirus. And there's no provision in the UK of crack pipes. So actually, what I think we need, better harm reduction provision in terms of outreach, in terms of providing more needles and syringes in more innovative ways. But we also need to have a letter of comfort to allow providers to provide crack pipes with end pieces on them, so that if people are sharing pipes, because that's going to be a real issue for transmission, that they're at least able to have separate mouthpieces. So, and so I think we need to look more broadly in terms of what else people are doing, that actually it may not just be around injecting that's a major risk of this virus, but smoking. So
you've raised the issue of most people who are using drugs regularly probably having poorer respiratory systems from either smoking drugs, smoking tobacco, smoking weed, and just because of their lifestyle having lower levels of immunity. So we know they're going to be at risk.
Yep.
So we don't want to really start saying to people, look, if you're smoking your crack, what you really want to be doing is asking for your dealers for coke powder so you can inject that. Although I do think dealers should be offering coke powder to people who are injecting so they don't have to inject crack. But it's not practical to say to crack cocaine users, you'd be better off switching to powder and not sharing your tubes. I mean, that's just not going to happen. And so I think you're right. All we can do is try and make sure people have got their own using equipment and encouraging social distancing as much as is possible. But then that leads me to ask the question, we spend a lot of time telling people who inject drugs not to inject on their own because of the risk of overdose. Now, from 2 meters away, you should be able to spot someone who's maybe going over. But it does strike me that we're caught between a rock and a hard place in the messages that we're giving people at the moment.
Absolutely. And, I think this is a huge worry. And, there's a great initiative in the UK at the moment in terms of trying to house all homeless people, provide them with rooms, for example, in hotels that are now empty because of coronavirus. And it's great. Homeless people should be given the opportunity of housing, but for me, there are additional concerns around this. And I think for some homeless people who use drugs, it could be quite scary, the thought of having to go and self-isolate alone. There could be a lot of fear about whether they're still able to use, whether they're going to be, restrictions around that, policing around that, but particularly they're going to be at huge vulnerability to overdose. So if people are placed in single occupancy rooms, told to self-isolate, perhaps given longer scripts of OST, which again, I think it's a good thing to get rid of the horrendous practice of supervised consumption. But there will be, you know, real vulnerability to overdose, particularly if the drug supply is impacted and we have fluctuating purity, so people don't necessarily know what they're getting hold of, or they're going to alternate and start using more benzos and alcohol to make up for bad quality heroin. So there are huge issues here, and I mean, something that my ideal solution, what I would like to see is, for example, if you're going to provide rooms for people in hotels, then there should be a designated room in that hotel, you know, a lounge or something, that's a supervised consumption room, where there could be seats set up 2 meters away, where people can go and use, and it doesn't have to be medically supervised, but it can be, you know, they have rooms like this in Canada where people can use, so there can be an element of sociability there, and people can look in and check for overdose. Because I think, you know, people are not really going to want to self-isolate. There's, you know, sociability is very important, not only to people who use drugs, but to all of us. But boredom will also be an issue for many people. Scoring and using as a real structuring element to their day, and just being stuck in a room and told to stay there, I think it could be a recipe for disaster without appropriate supports.
So I love that idea of almost having peer monitoring going in within a designated area with sharps boxes, and that being a respectful space that people could use. I mean, I love that idea, and that's something hopefully people watching this could actually take away and go, yes, this is something we could consider. I guess as a prescriber, I'm also hoping that people might have some time to consider, maybe this is now the right time for me to increase my methadone dose, so I don't feel the need to have to continue to use street heroin. So, you know, simply optimizing your doses. And I think most prescribers should be very receptive to someone coming in saying, look, I've been on 40 milligrams a day, I've been injecting 2 or 3 times each day on top, but I'm really worried about supply. Please put my dose up. And that's going to reduce the need for people to inject, which would be a good thing. You've spoken about the impact of loss of income in those grey markets of begging and sex work, which isn't something a lot of people would have ever considered as one of the ramifications. What do we think people whose livelihood has gone through those routes, what are they doing? How are they expected to survive? They're not going to have the government pay for their, you know, income. What can they do?
Exactly. I mean, it's a real worry. I'm actually particularly worried for women who've been engaged in sex work, and particularly if women are engaged in sex work to support not only theirs but their partner's habits. And we're seeing a rise of domestic violence all over the world amongst all populations, and people who use drugs are not going to be immune from that. But women who use drugs are particularly vulnerable because there's a huge fear of seeking help and disclosing that they're using if they've managed to keep it hidden for fear of their children being taken away. And I just think, you know, that we really need to be aware of the particular vulnerabilities of women at this time. Who may have their income completely decimated, and be more reliant on a partner, or not be in touch with services because they don't want to be identified as a user. And I'm not sure exactly what a solution is to that, but I think it's something we need to be very aware of.
Absolutely. What would you say to people who are currently using, saying, look, maybe I just need to take this as a good time to maybe try and stop using? Is coronavirus a good time to stop using drugs if you're someone with a drug problem?
Yes and no.
That's going to be my answer. I just thought, yeah. So give me the positives.
Well, yeah. I mean, look, if you're out there trying to score and there's no drugs and and your income sources have dried up, and you're able to get you know, methadone, and you're able to get a bigger amount of methadone, you have to go in for supervised consumption, and you feel okay about storing that and managing it, and not having anyone pressuring you to give it to them, which is another issue. Sure, it's a good time. It can also be a really hard time to give up, though, for a lot of people, because a lot of our supports, a lot of our things that keep us occupied and entertained are being taken away. And I think there's probably a huge increase in recreational drug use amongst people who use drugs, who, are stuck at home with 80% of their income or whatever, and thinking, twiddling their thumbs and thinking, what am I going to do? There are an overlap in these populations. Not all people who inject drugs are the vulnerable people that we see on the street. They're just the most visible.
So the advantage of detoxing yourself is that you wouldn't then have to be out there kind of scoring and using. Yeah. I guess my risk is for that group, when life without drugs, which at the best of times can be very difficult for people, now will probably even be harder. It's the return to use and the risk of relapse. It strikes me as the best possible thing for most people is to maintain as much of their usual supply and consumption as possible and try and secure that. But that's not always possible because people don't have funds to buy a quarter, keep it away. And we've spoken to people who have gone, I bought some extra drugs. I thought they'd last me a couple of weeks. Oh shit, they've all gone by Friday. So the idea of, it's not a safe supply. It's a cookie jar you can't keep your fingers out of. So we have to hope treatment services are respectful of that.
This issue of fluctuating supply, and some people, people are going to have to be prepared for detoxing whether they want to or not. This is probably an issue as well, and that however motivated you may be, there might be a point where you just can't get hold of the drugs, or the drugs are so rubbish that you're going to be in withdrawal anyway. So people should definitely get hold of, use the provisions in terms of methadone scripts. But I would love to see some pharmaceutical provisions provided for stimulant users. What about prescribers, prescribing dexamphetamine, or, looking at something, I think we need some innovative solutions here. It's a time to sort of be bold, because as I said, a lot of heroin users are also smoking crack, and while they can get OST for the heroin, they're not left with anything for the crack, and that can still create this desire to go out and look and score, and whether they find anything or not. But what I'm going to say also, with forced detox, or whether you want to come down, then when drugs come back up again, you have this huge vulnerability to overdose. So I think we need consumption rooms. They could be set up by peers. They could be, underground consumption rooms where you enable that physical distancing. I think it's better to call it physical distancing with sociability. And for people to look out for each other in case of overdose, because with the last heroin drought in the UK, people's tolerance will go down, and then they'll get a new batch. It will come back, and then they're vulnerable.
And I guess that's the benefit of stable access to a good methadone script, is that maintains your tolerance. And if drugs become harder to come by and are more expensive, then their absence then doesn't leave you at risk of overdose. So, I'd encourage people to look at, increasing their dose if it's not something they've done in the past, just to give them that extra buffer. And for you people using buprenorphine, maybe remembering that bigger doses last longer. 32 milligrams of buprenorphine holds most people for 2 or 3 days. So, that buys you quite a lot of time. The final thing I want to ask you is about the risk of displacement to prescription medications and to alcohol, which people will be familiar with when your dealer gets busted or you can't get out of the house or there's no money. My worry is that episodic access to a range of different CNS depressants is going to be a recipe for overdose. One day it's tramadol, one day it's Pregab. Oh, I've got a couple of Itazolams. I think these are blues, I'm not sure. Here's some amitriptyline. it'll get me through.
Yep.
That terrifies the crap out of me.
Yep.
Okay, that's good. That's two of us.
It's going to happen. I don't know what I can say. You know, I think alongside consumption rooms, I'd like supply of safe drugs, not just methadone. You know, give people the drugs they need, and give the people the drugs that they want. Let's have some pharmaceutical heroin. Let's have some decent cocaine. Let's keep people away from using those crappy drugs. You know, yes, people will definitely turn to benzos, to alcohol, to all of these things to maximise the drug effects. You know, and it is a danger. And I think this is also why it's very, very important to incorporate, you know, some sort of safe sociality into housing, into, you know, environments, that the message just shouldn't be to isolate, because you have such a heightened risk of overdose amongst a very vulnerable population with complex health problems already.
Absolutely. The last question I want to ask you is, I want you to gaze into your crystal ball. This is going to pass, and at some point Corona's going to become a Netflix series and we'll all go, you remember the days. It is unlikely that drug policy and drug treatment is ever going to be the same again. What would be the lessons you would ask policymakers to learn from Corona, so when we return to normal, we can implement those changes to make treatment better? What would you like to see?
People don't need to be on supervised consumption, that people can be trusted, and they should be trusted to be able to take away, you know, a week's worth or two weeks worth, and be provided with the supports to do so, such as locked medicine cabinets and things like that. That we need more innovative methods of supply of not only medications but also injecting equipment, and particularly smoking equipment. You know, I think crack pipes, people making their own pipes out of Martell bottles and things like this. They might be quite short, so the smoke they inhale is likely to be hotter, it's likely to do more damage to the lungs. You know, we need to amp up harm reduction for smoking as well. And what I would love to see in my crystal ball is good vaping technology for illicit street drugs. This is a fantasy of mine, to develop good vaping devices that are safe, that remove a lot of those particulates, and give people a decent high that people can use in public without being stigmatized. And also that would provide an attractive reason for people who are injecting to transition. You have to have something that's very attractive for people who want to transition from injecting. But, you know, more outreach, all of these things. I also think it's very important for people to be provided with the capacity to self-care for problems, injecting related injuries. You know, you have a huge amount of people turning up at A&E, it's their first protocol, being hospitalised for preventable conditions. And right now we're wanting to reduce strain on the NHS. And I'm also particularly concerned because people who inject drugs, they're so vulnerable because of their respiratory problems, that if A&E is their first port of call, they're putting themselves at risk. If they go to A&E, they're likely to catch coronavirus and get very sick and die. You know, so I'm really concerned about this. I think we need to attend to all those other health problems that people who inject drugs are struggling with all the time, in particular in relation to abscesses, cellulitis, leg ulcers, and get back wound care nurses and services, and get back outreach. And all of that's been decimated with the reductions to funding to drug treatment services in the UK.
Yeah, I mean, Alex Stevens in his interview went, it was a bloody nightmare and a crisis before Corona came along, with cuts to funding and record drug deaths. It's not like this is new, and it's not like the things we need to do suddenly dropped out of the air. These are all the basic principles of respect, human rights, treating people with respect, and empowering people to look after their own care. So exactly. I really hope some of the things that are being voiced by yourself and others aren't lessons we forget. And hopefully both drug laws and drug treatment will change for the better after this, has faded.
Yeah, absolutely.
Any last words of advice you want to give to anyone watching this, or?
No, not really. It's a hard one.
Oh yeah, and everyone's just gone. Wash your hands, keep your distance. Stay safe.
I think one last thing is we need to think about hierarchies of safe practice. So one thing that we've got a paper out recently is on difficulty of people accessing water for injecting. So we found that some people are using saliva, for example, to prepare an injection with, because they cannot access water. So saying to people, wash your hands, is an act, it feels like an act of violence to me, when they can't even access water to prepare an injection. And this is in the UK. And this is compounded by years of austerity, where it's more difficult for people to access public toilets, and public toilets have been closed. And then also the enforced security on cafes and things like that. Well, they've all now closed. So you think about people on the street and their actual ability to access water. If you have pubs closed, closed, all of these things. So, harm reduction services need to be giving out hand wipes, they need to be giving out, gel, they need to be providing, you need to provide the means for people to enact these suggestions, because if you don't provide the means, then all you're doing is enacting a structural violence. It's just...
It's such an important point. I hadn't even thought about that homeless people's access to running water in the UK and elsewhere has been cut off. So one thing governments could do is put in some publicly available taps.
Yes. Yes.
Which is what, yeah.
Yes, absolutely. Absolutely. Showers, taps. And this finding about people using, all sorts of things to prevent and to prepare injections with was before Corona came about, was before closures of cafes, and people were already having huge problems accessing water on the streets. So, it's a massive issue, and like anything that's implemented in relation to coronavirus cannot be a short-term measure. They have to, you can't house people just because there's an outbreak and then once it stops, kick them all out again. There has to be some sustainability to this as well. Yeah.
I totally agree. I'm just reeling from the fact that one of the things I'll take away from this is we need to provide people in the UK with access to running water. It's like, how has it ever got to that?
Yeah.
Right, that's a hugely depressing thing to end on, Magdalena, but thank you for your insights and your advice. It's really appreciated. So thank you so much.
All right.
I'm just going to hit the off button.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want, what's left to say, what's left to say. Cause I'm leaving all the pain today, meaning what I'm trying to say, believing I can find a way. Hey, and I'm dreaming, no need to show me how the reason you can't slow me down, season the moment only now.